My name is Sabrina Fields, and I am a graduate student at Midway University doing my capstone research. And this is my presentation for falls related to length of stay. And basically, this was geared to falls related to an inpatient healthcare facility, so like an acute care, ICU, that kind of facility. Um, So we are going to look at, so here are the objectives that we're going to be presented with throughout this presentation. And that is going to be the capstone problem statement. I did research 3 different countries to compare the rate of falls, the cost that falls were um, uh, attributed that the healthcare facilities had to absorb, definitions that may need to be looked at closely, purpose of the study, the limitations, the significance of the study, findings, and the conclusion. And this is mostly what my problem statement was, and this is in reference to also the cost to the facility, the patient themselves, and other payers, and results of future interventions and preventive techniques that facilities may have to um, look at in the future to try to prevent the increasing amount of falls. Falls do occur in 2 to 20% of all inpatient stays, and 10 to 30% of all falls that occur in an inpatient facility do result in an injury. So some of the countries that I did research was Canada, Europe, and the United States. So I decided they had 3 different areas to look at in reference to their type of insurance that they had, the proximity of the country, and just these are the 3 prominent countries that we have that gave the majority of the data that I could find. So some of the definitions that we need to look at is truly, what is a fall? A fall is involuntary descent to the floor, and that's basically was the fall's definition by the Centers for Medicaid Services. Actually, it's CMS, but it's called Centers for Medicare and Medicaid Services here in the United States. So it's an involuntary descent to the floor. But for Europe, their definition was a fall is an event resulting in a person coming to rest inadvertently on the ground or other lower level. So their definition is a little bit longer, but it does correlate with the definition that was given by the CMS. So it's basically uh, the same type of definition. And an inpatient fall is a fall event that occurred at a time during a single multi-day hospital stay. And basically what that is if they're there more than 24 hours and a fall happened, then that was counted on any of the research that was that I read. This is one area that a patient can fall in a hospital, is out of the bed. There are other areas that patients can fall. They can fall in the bathroom. They can fall while walking. They can fall out of a chair, out of a wheelchair. There are so many different areas in a hospital that a patient can fall. What are some ways that we can look at this and try to prevent this in the future? So the purpose of this research was to take a look at the different countries and how falls compare to the different countries in relationship to the length of stay, the cost, and prevention. So that's why I chose the 3 prominent countries that we have. They have different insurance areas that played a role in some of the research, but the different countries, we did look at the length of stay, the cost, and the prevention was the purpose of this. So some of the limitations that we found, or I found whenever I was doing this research, was very little research had been conducted on the length of stay resulting from the falls in all countries. There was length of stays, but it really wasn't conducted for a longer periods of time. It was very short periods of time. Also, some of the data was collected from different areas and not consistent across the countries. So it could have been I noticed from some of the data that was collected in all the countries that our research was, the data was collected. Some of them were in big metropolitan, multi-hospital companies, and then some of them they were trying to compare the data to a small 60-bed hospital. So that's apples and oranges. It wasn't apples to apples. So when you really look at that, there was some limitations on the data that was pulled from that. There was very little follow-up studies, I noted, that were performed to see any type of end results. And what I mean by that was some of the limitations was if they did there was one study I read was a 10-year cohort study. They looked at everything over a 10-year period, but they did not follow up with anything afterwards when they initiated any preventive techniques, any increased trainings to the staff to try to prevent falls on an inpatient basis. So the significance of the study is trying to figure out what research is available to truly determine the true picture of how falls affect the length of stay. And that's what I was trying to find, was the true picture of what it does and the costs and preventive techniques that healthcare facilities face moving into the future. So we asked the question to ourselves, and that is, what can be done to reduce falls? So the findings that we were finding throughout the literature reviews was there was various methodologies used throughout the findings to come up with some of the research from the larger metropolitan large company hospitals to the smaller hospitals. Most all of the research was done on retrospective observational studies, retrospective case-controlled studies, and multi-site prospective studies. So that would be more of your larger hospitals within a large company, so multiple hospitals there. So that was some of the methodology findings that we found. But when you go more in depth into the findings, we looked first at the length of stay, and in reference to the length of stay in all three countries, there was an increase in the length of stay if the patient had a fall. It wasn't whether it was a severe injury or a minor injury, just in the sense that they had a fall while they were in the hospital. So, but if the patient had an injurious fall, which is a fall with a significant injury, it was significantly even more increased in the length of stay. So when we looked at candidates, they ranged from up to 26.5 days all the way up to 34 days from a fall with injuries. The European partner ranged from 19 to 23 days. And then United States, depending on with the fall, it ranged from 6.9 up to 10.9 a day. So you have a huge range of differences there. And so there really wasn't much of a correlation. The main aspect was that it did increase in falls with an injurious fall, but there was no guideline or standard amount of days for all three countries that correlated with each other. So when you look at the numbers, the United States was less than Europe. Europe was less than Canada. What played into those factors? There was some factors that played into it in reference to whether they had insurance, whether they didn't have insurance, but there really wasn't no definitive guidelines for that. The cost of the falls in a healthcare facility also is one of the findings that we were looking at, and they can vary depend upon what the physician orders for follow-up care from a fall with injuries. So an injurious fall, a physician is independent on what they want to follow up with as far as what kind of care to give to those patients. So in Canada, it ranged all the way up to $44,000 and some odd dollars, which was a 95% increase on a patient's cost that did not even experience a fall. So if a patient fell in the hospital, their cost increased 95% over their counterparts that had no fall. That is a huge jump. And again, what was ordered for that patient? In Europe, it ranged around up to $10,000 and some odd dollars, and then United States had a low range of $7,136 all the way up to $30,000, almost $31,000. So when you look at these findings, again, it's like the rate of the falls from the previous slide that I showed you on length of stay. The cost varies from place to place also. So there's really no correlation for that. Each country had also a variety of preventive techniques and trainings that were used to reduce falls in their respective healthcare facilities. But each country did note, and this was one of the findings that correlated across the board 100%, was there was also a cost added to making new preventive techniques. And all of the countries that we researched did look at and had the same findings of different types of equipment, extra staff, different rounding techniques, protocols, and that type of stuff. And they all pretty much said this is what we need to do to try to decrease falls. So that was one correlation that was 100% across the board the same. So I want to discuss here for just a few minutes on the conclusions. So a couple of the things that you look at is the falls did increase with the length of stay. But again, as I said before, it was based on, it could have been a multi-site, large hospitals within a large company. It could have been a smaller hospitals. And another thing that was found throughout all three countries, Canada, Europe, and United States, was the increase in cost did go up on every country with a injury, a fall that resulted in an injury. But you have to look at it in a different way, is there was no standardization of what tests were performed on these individuals that had falls. Like if somebody falls and breaks a hip, do they do what's called a CT scan? Do they do the same, every facility, every physician do the same test in the same sequence, or do they just go to what they feel like needs to be performed and then move on from that point? So there was no standardization of procedures related to any type of injury from a fall. Various, as I said before on the last slide, the types of preventive measures used and trainings, they were different in each country on how they came across the trainings, on how they did the trainings, but the preventive techniques and everything were all basically the same. It's just how they decided to train their staff or the physicians and the nurses in their hospitals. So there really wasn't that big of a difference. All the preventive measures were there. It's just every country decided to do different things, but they all had the same preventive measures that they researched, but they only pulled certain ones out. And again, as I said in the very beginning, there was very little research found for any follow-up from all the preventive measures that were trialed. And there has been no further research done on the cost and or the length of stays for of what is truly causing the falls. There's nothing that shows, there is no research at all that is following up on any of these trials or the retrospective research that has been done as far as getting down to the basics of, okay, we had this many falls, where are we now after we put in all these preventive measures and gathered data? There was nothing there. So that, I feel, is probably the biggest part that really needs to push forward to find out, is everything that the hospitals in these countries are doing, is it making a difference or is it not? So that is really probably the biggest question that we have to ask ourselves on that. And here are some of the references that I have used. And do you have any questions? Questions are always guaranteed in life, but sometimes you just can't get down to the answers. And that's just the way I felt on this research. You can dig and dig and dig, but you just couldn't find out truly if there was any further research done on the 3 areas of length of stay. So any questions? Thank you very much.